Okay, depression in pregnancy. Myths about pregnancy and well-being. Yeah, this is true. A lot of people think, oh, everybody's really happy during pregnancy and that kind of stuff. Well, a lot of people are, but not people prone to mood disorders. Look at this. The risk of major depression, prenatal and postpartum, is the highest period of risk for severe depression in women, cross-culturally. 21% of them will develop major depression either during pregnancy or in the year following delivery of a child. Now, there's any number of reasons that this can occur, and one thing about postpartum, there are massive hormonal changes, but it's very hard to separate this out from a couple of other things. One is significant sleep deprivation that occurs with new mothers, okay, and the stress of having a baby, you know. So, but the part that suggests also hormonal changes is that you have higher rates of postpartum depression in women who also have premenstrual dysphoria and have menopausal depression. So it seems like there may be a link here with hormonal fluctuations in women. This is bad news. Discontinuing mood stabilizers and antidepressants during pregnancy, you can see you have extremely high rates of relapse of bipolar disorder, which can be absolutely devastating. Okay. Now, here's a story with, talked about this briefly in our last class. Drug companies do research with animals, but you can't do research with people, exposing them to certain drugs. But invariably, sooner or later, women take drugs, and then you follow them, and you know if they say, yeah, I'll volunteer to give information about myself and my baby and so forth. And you start accumulating data on whether or not a drug is problematic or not. And so this is always, the jury is somewhat out because the database is relatively small, even worldwide. It's certainly not zero, but there are many drugs that have been deemed to be okay during pregnancy, and then it's like, well, you know what? We're getting enough stuff happen here showing up that this is now not looking as good as it used to. So when people talk about a drug being safe during pregnancy or unsafe during pregnancy, you have to say that's a current snapshot, okay, that's subject to change as more data comes in. Among psychiatrists, I would say across the board, the consensus is the risk of not treating depression is significantly worse than exposure to antidepressants. Now, this is not true when you look at mood stabilizers or tranquilizers, which can, not all of them, but potentially can be, some of them can be very bad news during pregnancy, okay? So first off is hypercortisolemia, and from our last class, 60% of people with depression have toxic levels of cortisol that will go through the placental blood barrier and damage the brain of the baby, okay? Bad news. Substance abuse, especially alcohol use, is significantly greater during depression. And those of you who've taken my biology class have seen, whoops, I'm pushing the wrong button, seen this slide before. But if you haven't, the top one, this is a section of a newborn infant brain that's normal, and this is a section of a newborn infant brain where there was significant alcohol exposure in utero. Alcohol is devastating, absolutely devastating to the development of the brain, and is the #1 preventable cause of birth defects in the United States. So there are many people, and I've had women who've said, "Oh no, I don't want to take any antidepressants. I shouldn't take any drugs during pregnancy." And actually, I mean, it's absolutely necessary for people to be extraordinarily cautious about anything they take, over-the-counter medications as well. I've known that some of these women go home and drink, 3 martinis or something like that. So, it's an issue to consider. Okay, now, suicide attempts. I mean, I'm kind of stating the obvious here, but actual suicide or suicide attempts can really hurt or kill the fetus. Poor self-care is a big deal because when people are depressed, they don't eat well, they don't exercise, they don't take their prenatal vitamins, they don't show up for regular prenatal examinations. It's significant, okay? And then postpartum exacerbation. And if you're depressed during pregnancy, I mean, watch out because it's just going to get a lot worse quickly. Now, it turns out that most postpartum depressions have their onset at 4 to 6 weeks after delivery, okay? some minor mood changes that occur at the time of delivery, sometimes called the baby blues, is not pathology at all. It's just a degree of increased emotional sensitivity, but it may actually be quite good at helping mothers be more emotionally connected with their babies and that sort of thing. But if you're depressed ahead of time, then it could really throw gas on the fire and make it a lot worse after delivery. And okay, so I think we talked about this in our last class. Here again are the FDA ratings, and A and B are considered to be really no evidence from human and animal studies to suggest problems. D and X you should not use, and C is kind of on the fence. All right, now here's a story. This is interesting. Okay, I want you to give you the specifics, but give you a glimpse of what happens sort of politically with FDA. Okay, now back in 1994, all of the new antidepressants had a B rating, okay? And just like that, they all got degraded to C except Wellbutrin, okay? Now, the reason for this is because there was enormous pressure being put on FDA for other mistakes that it had made or what have you. So they revamped a lot of their policies to shift in a direction that's more conservative. And there was no new research that prompted this, but I mean, that's just what happens. Now, until about 2 years ago, Paxil had a C, and now it's been degraded to a D, and Wellbutrin has been degraded from B to a C. And you can see why here with Paxil. It's one of the worst. And these babies are, marinating in this stuff for 9 months, and they get born, and all of a sudden, guess what? They have acute discontinuation. That can happen with any of these drugs, right? That's not life-threatening, but, they don't feel good, okay? But it's because of increased risks of heart defects, okay? So it's a D. So you just shouldn't use Paxil. I mean, there's a lot of reasons not. Paxil's got more side effects than most of the other currently available antidepressants, new antidepressants. Well, actually, tell you what, maybe I don't know if I had this on a slide or not, but let me just mention this to you. Wellbutrin, since the 1980s, had a B rating, and it got degraded about 1.5 or 2 years ago to C based on an animal study. There's no human data suggesting it's problematic, but there was an animal study where they gave rabbits what amounted to almost toxic levels of Wellbutrin during pregnancy, and their babies were born and they had their pelvic bone was thinner than normal rabbits. And that was enough to get the FDA to degrade Wellbutrin to a C. And a lot of people in psychiatry are going, time out. We've had this drug around here for almost 30 years, But anyway, it gives you an example about what can happen. And once you get knocked down, guess what? You can't go back up. Let me give you one other example of this. Lithium, you ask almost any physician, call almost any psychiatrist, call any obstetrician and say, what about the use of lithium during pregnancy? Oh, no. D rating. You know why? Came out in 1970. By 1974, it had been associated in one study with an increased risk of a minor cardiac defect, okay, that can be problematic, can also be surgically repaired, called Epstein's anomaly. Every study since then, since 1974, has failed to replicate that. And does FDA do? No, FDA, once it's downgraded, it never goes back. And lithium sometimes is what really keeps a lot of these people alive. So I obviously I have strong feelings about this because, if the evidence was supported, that would be different. Okay. Anyhow, antidepressants meta-analysis. Look at that huge sample size, right? First trimester exposure, major malformations, birth defects, 2 to 3%, not statistically different than you get in the general population. Okay. Now, but that's group studies. Okay, group studies. Small but statistically non-significant increase in miscarriages. That sounds troublesome, except for this, and that is looking at miscarriages compared to the general population. not miscarriages in non-treated depressed women. Does that make sense? That's where the comparison should occur. For a long time, they said, oh, but all these antidepressants are problematic because you have a 20% greater likelihood of premature birth, until a study that came out about a year ago looked at non-medicated depressed mothers, and they also had a 20% greater increase in premature birth. Okay. Here's the other thing. Typically, if you have a drug that causes birth defects, it causes the same birth defect in one kid after another, after another, after another. Cleft palate or spinal bifida or something like that. And if you look at antidepressants and you see birth defects, it's just like in the general population. A little bit here, a little bit there, a little bit here, a little bit there. Now, Paxil was associated with cardiac defects. And so what's come under the microscope of FDA is looking at other SSRIs. And if this occurs, then we need to find out about it. The data is not strong at this point, but bears watching, okay? Because there are a lot of people who have, in all good intentions, say, no, this drug is fine, and 3 years later they say, well, actually, you know what, it isn't. Okay, so we have to just keep a watch. But I think it's, in medicine, it's always risk versus benefit. That's the issue. All right, jury's still out. In terms of breastfeeding, general consensus is the antidepressants are okay to use during breastfeeding. You can see here that on average, well, you may not be able to see, but 7%, that is the level of the antidepressant in breast milk compared at 7% of the mother's blood level. So often is the lowest. But the real bottom line is here is that when these babies are being breastfed and then you take a blood sample, you can't find any traces of the antidepressant. The antidepressant is being excreted in breast milk, but it's minuscule, but then it's being metabolized then by the baby's liver. And does this mean, there aren't any molecules of antidepressant in their bloodstream? No, but if they're there, they're tiny and they're really not problematic. But once again, this is not true with a number of the mood stabilizers, including lithium and tranquilizers. Those are secreted in breast milk and can be problematic, if not dangerous, for babies.